All right, so today we're going deep on something pretty wild. Human energy fields.
HEFs.
Yeah, HGFs. You got it. And, you sent over some pieces of this article called Human Energy Field, a concept analysis from the Journal of Holistic Nursing.
It's a fascinating one.
Oh, yeah, it is. So we're going to try to break this down. What are HEFs? What's the controversy around them? How could this apply to nursing and, just beyond?
Well, the idea of this like universal life energy, this has been around forever.
Oh, for sure.
Different cultures, they've all had their names for it.
Right.
Ki prana, even some of the Native American traditions, terms like Oki or Renda and ton.
Yet it is interesting how this idea pops up everywhere, this like vital life force kind of thing.
Mm-hmm.
And, even now with all of our technology and all this science, HEFs are still kind of a mystery.
Yeah, they are.
Getting more popular, more people are talking about them. But there's a lot of skepticism, too.
Oh, absolutely. And, the article even mentions this big controversy. Back in 2014, the North American Nursing Diagnosis Association, International... MANDI, that's it.
Right.
They actually got rid of this whole nursing diagnosis called disturbed energy field.
Really?
Yeah, they said there wasn't enough evidence to back it up, which caused a lot of discussion.
Wow. So if something like disturbed energy field was considered too much too out there, how do we even begin to describe what an HEF is?
Right, that's the challenge. So this article defines it as like a luminous field of energy that comprises a person, extends beyond the physical body, and it's like in this back and forth with the environmental energy field.
So it's not just this bubble around us.
No.
This energy field is actually like intermingling with everything around us.
Exactly. It's dynamic, it's always changing, and it's thought to have its own unique pattern.
Okay.
And the article really highlights how the HEF is characterized by dynamism, creativity, non-linearity, and unpredictability.
Right.
It's not something you can easily measure or quantify.
Right.
And here's the thing, it flows at different frequencies, and that affects its balance. So you can think of it like this, a balanced HEF is like a well-conducted orchestra. Everything's in harmony, there's flow, there's rhythm symmetry, gentle vibrations.
That makes sense. But if it's so hard to pin down, how are researchers even trying to study this scientifically?
Well, you've probably heard of the biofield.
Yeah.
Some researchers are looking at the idea that the HEF might be like a communication system within the body, influencing our internal systems. And that could explain how practices like energy medicine actually work, even though they might seem a little out there to some in traditional medicine.
Okay. So we're talking about things like therapeutic touch Reiki, that kind of thing.
Yes.
Yep.
Those practices are working with this subtle energy. And what's interesting is that there are scientists like Rauscher, Ryan, Rubik, Schwartz, and Rusick who are trying to bridge traditional medicine and energy medicine.
Wow.
They're actually using concepts from quantum physics to study the HEF and see if these subtle energies can be measured and understood.
So it's almost like we're on the edge of discovering a whole new way to look at the body and how it functions.
Exactly. And the article points out how Rogers' science of unitary human beings has really influenced nursing.
Yeah.
It's paved the way for a more holistic approach where the HEF isn't just some strange concept, but a factor in understanding a patient's overall health.
Makes a lot of sense. So let's get into the nitty-gritty. How could understanding the HEF actually change the way nurses do their jobs?
Well, the article suggests a few ways. First off, imagine a nurse who's sensitive to these subtle energy imbalances. They might pick up on things a traditional assessment wouldn't reveal, getting a more complete picture of what the patient is experiencing.
It's like having another layer of perception. You're not just seeing the physical, but also the energetic.
That's a great way to put it.
Right.
And this leads to the second point. By understanding the HEF, we might finally get a clearer picture of how therapies like therapeutic touch Reiki, even acupuncture and meditation work. They all work with the body's energy in different ways.
So instead of writing these practices off as alternative, nurses could start to see them as valuable tools for healing.
Absolutely. It's about recognizing that there might be more to healing than just what we can see and measure with conventional tools.
Makes sense.
Yeah.
So what else does the article highlight about HEFs and nursing?
Well, it suggests HEF awareness could even change the way nurses communicate.
Really?
When a nurse is attuned to a patient's energy, they might be able to create a deeper connection. It's that feeling of truly understanding someone on a deeper level.
That's powerful. It's about recognizing we're not just physical beings, but also energetic beings. And that energy plays a role in how we connect with each other.
Exactly. And finally, the article stresses the importance of self-care for nurses. Imagine a nurse who's aware of their own energy field.
Okay.
They're more likely to be grounded and resilient, which leads to better care for their patients.
It's like filling your own cup first so you can better serve others. If a nurse is energetically depleted, that's going to show up in their interactions with patients.
Absolutely. And to really illustrate this, the article includes a model case that shows how powerful HEF awareness can be. It tells the story of Alice, a nurse working with a patient recovering from major cervical spine surgery. This patient is having a really hard time moving from her wheelchair to the toilet, and there's a lot of tension in the room.
I can already see where this is going. Negative energy can be a real barrier to healing, can it?
Exactly. Alice picks up on how the nursing assistant's frustration is feeding into the patient's self-doubt and fear. She can actually sense the patient's energy becoming heavy and blocked, especially around her upper abdomen.
Okay, so what does Alice do? How does she use her HEF awareness to help?
Well, instead of just pushing through, Alice recognizes that the energy in the room needs to shift.
Okay.
She pauses, centers herself, and guides both the patient and the nursing assistant to take a few deep breaths. She encourages the patient to feel her feet on the floor, to really connect with her body and her breath.
It's like she's clearing out the stagnant energy and making space for something more positive to flow in.
That's a great way to put it. As they breathe together, Alice focuses on filling herself with compassion for her patient. And she can feel a shift happening as the patient's energy starts to loosen up.
This is such a cool example because it shows how a nurse's intention and presence can directly affect the energy field.
Exactly.
Yeah.
And guess what? It works. The patient stands up with minimal help from Alice. It's a real breakthrough for her, and it all started with shifting the energy in the room.
That's amazing. It really shows that HEFs aren't just some abstract concept.
Yeah.
They can have a very real impact on how people heal.
Absolutely. And you know, the article isn't just about nurses. It encourages everyone to think about their own experiences with energy. Have you ever walked into a room and immediately felt the vibe or felt a deep connection with someone without even saying a word?
Right.
Maybe understanding the HEF can shed some light on these everyday experiences.
It's like a gut feeling you get about a person or a situation, but maybe it's actually our energy fields connecting on some subconscious level. It's so fascinating.
It really is. It raises so many questions about how we interact with the world around us.
I know. We barely scratched the surface here. But I think you're always starting to see how thinking about HEFs can open up a whole new way of understanding ourselves and our world.
Absolutely. It challenges us to look beyond what we can physically see and consider the subtle yet powerful influences of energy.
We'll be back in a moment to continue exploring this amazing topic.
And it's important to remember that there isn't one definition of the HEF that everyone agrees on.
Right. It's such a complex idea.
Mm-hmm.
So how does this article handle all these different viewpoints?
Well, it does a good job of showing us different perspectives
Right.
from, various nursing scholars and researchers who've studied this.
Oh, cool. So like a deep dive within the deep dive.
Oh, exactly.
Okay. What are some of the ways people think about the HEF?
Well, a lot of the nursing research on HEFs, it really builds on the work of Martha Rogers,
Oh,
a
yes.
prominent nursing theorist.
Right. Rogers' Science of Unitary Human Beings. A cornerstone of holistic nursing.
Precisely. In Rogers' view, the HEF is a core part of what she called the human environmental field process.
Okay.
So basically, she believed that humans and their environment are constantly exchanging energy.
So we're not just these isolated beings. We're part of like a larger energetic system.
Exactly. Rogers emphasized that the human and environmental fields, they're unique but inseparable,
Okay.
both constantly changing and influencing each other.
That's a really interesting way to think about it. So what does this mean for nurses who are trying to understand the HEF?
Well, Rogers' theory really emphasizes the dynamic, ever-changing nature of the HEF.
Oh, okay.
She used terms like resonancy to describe the continuous change through energy flow and helicity to highlight the unpredictable nature of those changes.
So instead of thinking about the HEF as a static thing, we need to see it as like a dynamic force always in motion.
Exactly. And the article explores other perspectives, too.
Okay.
Researchers like Brennan and Coons, they describe the HEF as an energy system with specific structures like the aura chakras and meridians.
So are we talking about the aura, like that glowing halo you see around people in like spiritual art and stuff?
You got it. And when we talk about chakras, think of them as energy centers along the spine,
Okay.
each connected to different parts of us physically, emotionally, and spiritually.
Okay.
And meridians are like channels that energy flows through, similar to how blood flows through our veins.
It sounds like we have this whole intricate energetic anatomy within us,
Mm-hmm.
and it's always interacting with our environment.
That's the idea. And these different structures work together to keep energy flowing smoothly.
Mm.
And keeping that balance is thought to be essential for health and well-being.
That reminds me of how traditional Chinese medicine focuses on keeping the qi flowing through the meridians.
You're right to make that connection.
Yeah.
Lots of cultures have practices focused on balancing the HEF. But the article doesn't just focus on definitions, it actually dives into how HEF awareness can be used in nursing.
Right, because we've talked theory, but I'm really curious about the practical application.
One example is patient assessment. Imagine a nurse who's tuned into a patient's HEF.
Okay.
They might sense subtle imbalances that traditional assessments might miss.
Okay.
It's like having an extra set of senses.
So you're not just looking at the physical, but also sensing the energetic, picking up on cues that others might overlook.
Exactly. And this awareness can influence how nurses approach complementary therapies like therapeutic touch and Reiki. They can start to see how those practices work on an energetic level to support healing.
Instead of dismissing them as alternative, they're seen as valuable tools to be integrated into healthcare.
Precisely. The article also talks about how understanding the HEF can improve communication.
Really?
When a nurse is present and mindful of the patient's energy, it creates a deeper connection,
Okay.
which can be incredibly healing.
It's about that unspoken connection, that feeling of being truly seen and heard, which can be so important, especially when someone's feeling vulnerable.
You're absolutely right. It's not just about words, but also about the energy we bring to the interaction. And remember, the article also emphasizes self-care for nurses.
Right.
If a nurse is aware of their own HEF and manages their energy, well, they'll be more resilient and able to provide more compassionate care.
It all comes back to that idea of you can't pour from an empty cup.
Right.
If a nurse is drained and depleted, it's going to affect the care they provide.
Absolutely. And the article shares some really interesting examples of how nurses are using HEF awareness in real-life situations.
Let's hear one. I love seeing how this actually plays out in practice.
There's this compelling case study about a nurse named Madrid.
Okay.
She's caring for a patient nearing the end of their life
Okay.
and feels overwhelmed and drained by the experience.
That's completely understandable. End-of-life care can be incredibly emotionally challenging.
Yeah.
So how does Madrid use her HEF awareness to deal with this?
She uses something called pattern manifestation appraisal, which basically means paying close attention to her own energy field and noticing how it's being affected by the situation.
Right.
She realizes that her own negative emotions are preventing her from being fully present for the patient.
Wow, that's a powerful realization. Recognizing how our own energy can affect those around us.
Exactly. So she makes a conscious choice to shift her energy by practicing grounding techniques, doing breathing exercises, and setting a positive intention.
It's not about ignoring or suppressing her emotions, but actively transforming them into a more supportive energy.
Precisely.
Yeah.
And through this process, she's able to show up for the patient in a more peaceful and loving way, which benefits both of them.
What a beautiful example of how HEF awareness can empower nurses to be more present for their patients, even in incredibly challenging situations.
It really is. And it highlights another key aspect of HEF awareness: intentionality.
Okay.
It's not just noticing energy, but actively choosing to direct it in a positive and healing way.
So we have some control over our energy fields. We're not just at the mercy of external influences.
That's right. We can learn to cultivate a more balanced and positive HEF through practices like mindfulness, meditation, energy work, and even just being more aware of our thoughts and emotions.
It's empowering to realize that we have a role to play in shaping our own energetic reality, both for ourselves and for those around us.
That's a great way to put it. And the article emphasizes that this intentionality is a key element in many complementary therapies like therapeutic touch and Reiki.
Right, because practitioners often talk about setting an intention for healing or directing energy for a specific purpose.
Exactly. And this intentionality can also play a role in how we communicate, whether it's with patients, colleagues, or loved ones. When we're mindful of our energy and intentions, it can have a huge impact on the quality of our interactions.
It's like we're all sending out these energetic signals, and they can either lift people up or drain them. It makes you think twice about the energy you're putting out into the world.
It really does. And the article encourages nurses to be mindful of the energetic impact they're having on their patients, to be aware of the energy they're bringing into the room.
It's like stepping into the role of a healer, not just through your actions, but also through your very presence.
That's a powerful way to frame it. And the article also talks about how HEF awareness can help nurses understand how different complementary therapies actually work.
Oh, let's dive into that a little more. How does the concept of the HEF bridge the gap between conventional medicine and energy-based approaches?
Well, remember we talked about the biofield hypothesis earlier?
Right. The idea that the HEF might act as a communication system within the body, influencing things like bioregulation and potentially explaining how energy medicine works.
Exactly. The article highlights research that suggests the HEF might be a conduit for information, which could explain how therapies that work with subtle energy, like therapeutic touch or acupuncture, have tangible effects on the physical body.
So instead of seeing the body as a bunch of separate systems, we're starting to understand it as a network where energy and information are constantly flowing.
Exactly. And as we learn more about the HEF, we might unlock even more profound insights into the nature of healing.
It really does feel like we're on the brink of something new and exciting in healthcare, where science and spirituality are starting to intersect.
It's a fascinating frontier for sure. And the article points out that exploring the HEF isn't just relevant for nurses, it has implications for anyone interested in personal growth, self-healing, and exploring the deeper dimensions of human experience.
Right, because we all have an energy field, whether we're consciously aware of it or not, about tuning into that part of ourselves and understanding how it influences our lives and our interactions with others.
Absolutely. By becoming more attuned to our own HEF, we can cultivate more balance, the vitality and connection with ourselves and the world around us.
It's a journey of self-discovery that takes us beyond the physical and into the energetic realms of our being.
And as we do so, we might be surprised by the power of this subtle but profound force that connects us all.
It's like we're all part of this grand symphony of energy, each playing our own unique part.
I love that image. It really speaks to the interconnectedness of everything.
This has been so insightful. I'm really starting to grasp how understanding the HEF can change the way we view ourselves and the world.
It's definitely a paradigm shift, and the article also touches on how visual imagery can help us understand the HEF.
Oh, that's interesting. It's not something you can see with your physical eyes, so how do people try to represent it visually?
Well, the article mentions artists like Alex Gray, whose work often depicts the HEF as this radiant field that surrounds and extends beyond the physical body.
I've seen some of his paintings. They're incredibly detailed, almost like maps of the subtle energy body.
Exactly. And there are other visual representations too, like diagrams of the aura chakras and meridians. These images can be helpful for people who are trying to grasp this concept, giving them a visual reference point.
It's like we're trying to translate this abstract energetic idea into something our minds can understand. We're using visual metaphors to represent something we can't perceive with our physical senses.
That's a great way to put it. And these visual representations often emphasize the dynamic flowing nature of the HEF and its constant interaction with the environment.
Even though we're using static images, they're meant to convey a sense of movement and energy exchange.
Exactly. And the article also highlights the importance of looking at real-world examples or case exemplars to understand how HEF awareness plays out in different situations.
Case exemplars. That sounds like a great way to see how these concepts are applied in real life.
They are. The article presents a variety of cases showing both the presence and absence of HEF awareness and how it affects the outcomes of different situations.
So there's like a spectrum of examples that illuminate different aspects of HEF awareness.
Exactly. And these cases offer valuable insights for nurses and anyone who wants to understand how to integrate HEF awareness into their lives.
Can you give us an example of one of these case studies? I'm really curious to see how this plays out in a narrative format.
Sure. There's this contrary case about a nurse who's extremely efficient and task-oriented,
It's okay.
but seems to lack genuine connection with her patients.
I can picture it now. A nurse who's great at the technical aspects of her job, but maybe not so tuned in to the emotional and energetic needs of the people she's caring for.
Exactly. She goes through the motions, but there's a sense of detachment in her interactions.
Yep.
She's not really picking up on the patient's emotional states or unspoken needs.
So she's missing that key energetic element of care, that intuitive understanding that goes beyond the physical symptoms.
You got it. And the article contrasts this with a model case where the nurse is very present and attuned to the patient's energy field. This nurse can sense the patient's anxiety, fear, or even unspoken pain, and she responds with genuine compassion and understanding.
It's a perfect illustration of the difference between simply providing care and truly being present with the patient, recognizing their wholeness as an energetic being.
That's beautifully said. This model case shows how HEF awareness can guide a nurse's approach to assessment communication and even the interventions they choose.
So it's not just a theoretical concept, but a guiding principle that can shape how nurses approach healing and interact with their patients.
Absolutely. And these case exemplars are valuable learning tools. They help nurses to identify areas where they might be able to strengthen their own HEF awareness and cultivate a more holistic and compassionate approach to care.
It's like holding up a mirror, showing us our strengths and areas for growth in terms of our energetic sensitivity and intentionality.
Exactly. By examining these cases, nurses can gain a deeper understanding of the nuances of HEF awareness and how it applies to patient care.
It's like a roadmap for developing a more conscious and intentional approach to healing, recognizing the interconnectedness of our energy fields and the profound impact we can have on each other.
That's a powerful way to summarize it. And what's particularly interesting is that the article doesn't just present HEF awareness as some esoteric concept, but emphasizes its relevance for professional nursing practice and even nursing education.
That's an important point because for many people, the HEF might seem like something that belongs in the realm of spirituality or alternative medicine, not mainstream healthcare.
Great. But the article argues that HEF awareness is actually essential for nurses who want to provide truly holistic and patient-centered care. It's about seeing the patient as a whole, being encompassing not just their physical body, but also their energy field emotions and spiritual dimensions.
So it's about bridging the gap between the scientific and the energetic,
Like
embracing a more expansive view of health and healing.
Exactly. And the article suggests that integrating HEF awareness into nursing curricula can empower future generations of nurses to embrace a more holistic and compassionate approach to care.
It's about giving them the tools and the knowledge to perceive and interact with the subtle energy dynamics that are always at play in healthcare settings.
That's the key. And by doing so, we can help create a more human-centered healthcare system that honors the interconnectedness of body, mind, and spirit.
It's a vision of healthcare that recognizes the profound healing power of human connection and the transformative potential of working with the body's energy systems.
And it's a vision that's gaining traction as more and more healthcare professionals are seeing the importance of incorporating these energetic principles into their practice.
It's an exciting time to be exploring the frontier of energy medicine and its implications for nursing and beyond.
Absolutely. And as we continue to learn more about the HEF, we might unlock even more profound insights into the nature of healing and well-being. But before we go any further, let's take a quick break. We'll be back in a moment to wrap up this fascinating deep dive into the world of human energy fields.
Welcome back to our deep dive into human energy fields. We've covered so much ground, from ancient traditions to the latest research. We even looked at how some nurses are using this in their work.
It's been quite a journey.
Yep.
And one thing that really stood out to me from the article was how it addressed the controversy around the HEF.
Yeah.
Specifically, that decision by Nanda I to retire the nursing diagnosis, disturbed energy field.
Right, that was a big deal. It caused a lot of debate about whether the HEF is even a legitimate concept for nurses to be thinking about.
Oh, absolutely. The article really digs into those concerns and makes a strong case for why the HEF should be recognized and brought back into the Nanda I system.
So it's not just defending the HEF against the critics.
Yeah.
It's showing how it can actually help nurses.
Exactly. The article points out that even though the term HEF isn't always used, the principles behind it are already present in lots of nursing practices.
Oh, that's interesting. Can you give us some examples?
Well, think about the emphasis on therapeutic touch, on being present with patients, on providing compassionate care.
Okay.
These all acknowledge the energetic dimension of healing, even if it's not explicitly stated.
So even without using the term HES, nurses are already working with these principles.
That's right. And the article suggests that by formally recognizing the HEF, we can actually make these practices even stronger and give nurses more tools to work with this subtle but powerful force.
It's like we're shining a light on something that's already there, making it more conscious so we can use it more intentionally.
I like that analogy. And the article goes even further, suggesting that understanding the HEF can help nurses become better critical thinkers.
Okay. Now that's an interesting connection. What does the HEF have to do with critical thinking?
Well, when you're aware of the HEF, you're basically expanding your perception.
Okay.
You're picking up on these subtle cues and patterns that you might have missed otherwise.
It's like having an extra sense. You're not just seeing the physical, you're also sensing the energetic.
Exactly. And having this expanded awareness can help nurses make more informed decisions. They're not just considering physical symptoms, but also the energy, the emotions, the whole picture.
So it's about looking beyond the obvious, considering different perspectives, seeing the bigger picture, which are all hallmarks of good critical thinking.
You nailed it. And that holistic approach really aligns perfectly with the concept of the HEF. It's about recognizing how everything is connected.
This is really fascinating. And the article also talks about how the HEF can be used in research.
Right, because research is so important for moving the profession forward and understanding what really works.
Exactly. So how can we bring the HEF into research?
The article suggests that by incorporating HEF awareness into our research methods,
Okay.
we can start to understand how energy impacts health, healing, well-being in a more scientific way.
So it's about expanding our research to include these subtle energy dynamics.
Exactly. And that could lead to some amazing discoveries.
Wow.
And new ways to approach healthcare that utilize the power of the HEF.
That's an exciting possibility.
Yeah.
It's like opening up a whole new area of scientific inquiry.
Absolutely. And speaking of the future, the article also highlights the importance of teaching about HEFs in nursing education.
Right, because if we want future nurses to be comfortable with this concept,
Yes.
they need to learn about it during their training.
Exactly. The article suggests that integrating HEF awareness into nursing curricula can help students become more sensitive to their own energy fields and the energy fields of their patients.
It's about creating a more conscious and intentional approach to care, where nurses are aware of the energy in every interaction.
Exactly. And this could even start to shift the whole culture of healthcare,
Wow.
making it more human-centered, more holistic.
Imagine a healthcare system where working with the HES is just normal,
Right.
an integral part of providing really compassionate care.
That's the vision the article puts forward, and it makes a really strong case for why it's both achievable and essential.
It's a call to action
It is.
for nurses, educators, researchers to recognize the value of the HEF and embrace its potential to improve care and, change healthcare as we know it.
I think that's a perfect way to sum it up.
Yeah.
This article is a real call to action. It's urging us to look beyond just the physical and recognize the power of energy in healing and well-being.
This has been an incredible deep dive. I feel like we've just started to explore this,
To scratch the surface.
but I'm already seeing things in a whole new light.
Me too.
Yeah.
It's a topic that sparks curiosity and invites us to keep learning.
Absolutely.
There's so much more to discover about the HEF and how it impacts healthcare and beyond.
And I hope our listeners are inspired to keep digging into this and, see the world, see themselves through this lens of energy.
Me too. It's been a pleasure diving into this with you.
Likewise. And to all our listeners, thank you for joining us on this journey into the world of human energy fields. Until next time, keep exploring, keep questioning, and keep shining your light.